The nursing staff, the doctor staff, the cleaning staff, the catering staff became your family. I'm Brian O'Reilly. I'm living in Rathfarnham, Dublin, originally from Waterford, and I'm 44. Back in 2017, I was diagnosed with testicular cancer. Went through the system there in Beacon Hospital, and then from that I developed AML leukemia. I was diagnosed in St. James's on Friday the 13th of September, exactly 2 years after the testicular diagnosis. When I came in first, all really friendly, they were beside you chatting, and then within 2 days, the big gowns, masks, goggles, keeping 2 meters away. My husband was told, this is your last visit, you can't visit anymore. Having no guests or visitors come in, it's hard because you're just missing the contact of your friends, and no matter how much you ring them and phone them or FaceTime them, it just wasn't the same. So the nursing staff, the doctor staff, the cleaning staff, the catering staff became your family, because they were your people who you contacted every single day. Even at that, what was happening is they couldn't come into the room, so they'd intercom you. And half the time you wouldn't hear the intercom because your television would be on. You just hear this voice in the background going, "Are you okay, Brian? Do you need anything?" And it was kind of a bit surreal for the first 2-3 weeks. So all your food was left outside. So you had to go out and collect your food and bring it back in, because they couldn't come into your room for hygiene reasons and for cross-contamination.
These patients, have unexpectedly developed a cancer that they had no control over. But many patients have compared it to a prison cell. And when you see the rooms, you will appreciate that they're quite stark. Because we're so busy trying to keep them clean, they're not encouraged to keep very much things on the wall. In actual fact, more recently, they've started to put clocks on all the walls to try and allow them to visibly see how time passes. But one of the ladies yesterday said that was an additional torture, because the days and nights get mixed up, because many of them are on medications. They sleep during the day, they often need morphine to control their pain. The days and nights get mixed up, and the clock often adds to the confusion. It's very difficult anyway having a transplant, but the isolation and the absence of visitors and families has made it a lot more difficult for the patients, I think.
You just have to kind of click over, say, okay, this is the new normal, this is what's going on. We have to work this way, and either you go with it or you go against it. But either way, you have to go with it in the end. And it's for everybody's protection.